The acquired ataxias typically come on more rapidly and worsen more rapidly. So if you have somebody whose ataxia has worsened over weeks to a few months, you'll look for an acquired cause. An underlying cancer that's making a bad antibody that's attacking the cerebellum, or, a poison or toxin or environmental exposure that may have triggered it, or a viral infection, relatively common in children with sudden onset ataxic symptoms. Certainly for a patient presenting with an ataxic disorder, with or without peripheral neuropathy or dizziness or some of the things that may go along with it, you work up for vitamin deficiencies, you work up for brain tumors, you work up for all of the more common acquired things, multiple sclerosis. At some point, that workup should include an evaluation of the immune system. Paraneoplastic antibodies that could be signs of a small hidden cancer, other antibodies that could be produced that could target the cerebellum, even without a small hidden cancer, because these things can be treated. The GAD antibody, GAD, which is responsible for stiff person syndrome, people don't think that it can also cause ataxia. So they order a panel of antibodies looking for a hidden cancer. It's negative. And then I get to fill in the GAD antibody. And, that does come up periodically and it is amenable to treatment. Some of the other things that get overlooked, a history of alcoholism. Somebody, you ask, do you binge drink? You ask about, truly abnormal alcohol behaviors. But for some individuals, chronic alcohol intake over many years can lead to peripheral neuropathy, can also lead to a cerebellar disorder. So you really have to get a good history of, the person's behavior, work-related exposures. If they're working with poisons and toxins, volatile solvents, that can also take away reserve and leave them open to a cerebellar problem as the brain ages.